Good morning, good afternoon, good evening to everyone, and welcome, a very warm welcome to this very first virtual High Commissioner's Dialogue on Protection Challenges. It is organized by the UN High Commissioner for Refugees and with strong support from PHAP, Professionals in Humanitarian Assistance and Protection. Before I start, I want to hand the floor over to Marcus Forsberg, who's going to go over a few of the technical details for us today.
So interpretation, first of all, is available in Arabic, English, Farsi, French, and Spanish. Please select your preferred language using the interpretation button that you will find at the bottom of your screen. If you encounter any issues with the platform, we are providing video backup live streams in English and in French, as well as an audio-only live stream in English. Please use the URLs shown on your screen, and my colleague Jane will also share these links in the chat, and you will find them in the instructions email that you received. There are also English closed captions for increased accessibility. To enable, click on the CC button and then choose Show Subtitle. To submit questions for the speakers or to comment on anything during the event, please use the Q&A button. You will also find it at the bottom of your screen in Zoom. Note that you also have the option to submit your question or comment anonymously. If you're following the live stream or if you're following in the event app, please type your question or comment in the chat instead. And with that, I'll hand back over to Kelly.
Thank you so much, Marcus. I think it's safe to say that with this virtual format, we have the largest participation for High Commissioner's Dialogue in recent years. I'm delighted to be the moderator for you for this session this afternoon here in Geneva. Some participants have already submitted questions, and we thank you for those. In fact, our distinguished panelists have already incorporated some of those questions into what they will relay to you this afternoon. Other questions will be addressed in sessions we will have in November and then a final session in December on protection, inclusion, and climate action. If we can't answer your questions during the dialogue, please keep coming back to the app where answers will be provided there as well. The dialogue this year is focused on the theme of protection and resilience during pandemics. It will consider the implications, of course, of COVID-19 on the protection and resilience of refugees, of internally displaced persons, of stateless persons, and host communities. It's an occasion to reflect on how to address the pressing protection and solutions questions that we all have, builds upon the international refugee protection regime and the principles and arrangements that were laid out in the Global Compact on Refugees. There will be 4 virtual sessions, this opening session, a session on protection, on resilience and inclusion in healthcare systems, and lessons learned for climate action. It will then conclude in a session, we think, in December with details to follow to wrap us up for this year. I want to next introduce the panel to you. Very delighted to welcome Mr. Filippo Grandi, who of course is the UN High Commissioner for Refugees. In Geneva, Mr. Shadi Shahade, who leads an initiative called Aide de Réfugiés. In Peru, Dr. Carmen Parra, member of the COVID-19 National Response Team. In Iran, Dr. Ferza Hosseini, who's head of the Coronavirus Public Outreach Program. In France, Ms. Hindu Umaru Ibrahim, the SDG advocate for climate action and indigenous rights. In Kenya, Mr. Nyal Deng, global change maker for 2019. And in Zimbabwe, Mr. Bartholomew Ngani Mwanza, who's a global youth advisory council representative and who I was pleased to meet in New York last year on the margins of the General Assembly. So now we'll take a look at a video to get us started in this discussion, this dialogue this afternoon. Please contribute your questions in the Q&A or the chat features.
How do you stay safe at home when you had to flee your home for safety? What does protection look like in a pandemic? The need to support and defend the world's forcibly displaced is greater than ever. But the coronavirus has strained our ability to respond.
The numbers resettled this year have been severely reduced, with the limited numbers of places made available further impacted, of course, by the pandemic, including disruptions to international flights and closed borders.
Access to asylum, access to territory. Life-saving international laws are being tested as some countries shut borders. And economic chaos has unleashed new hardship on the most vulnerable.
We are struggling to buy food, and mostly the money that we get is not enough to cover all the expenses that we have in the house.
But in a time of COVID, we also find hope. In smart decisions to include refugees and national health responses. In our own determination to bolster programs that combat the impact of coronavirus, from social support to virtual education. In the solidarity of nations which still welcome refugees for resettlement and a new beginning. And in the acts of everyday heroes.
Quand la société a bien frappée par une maladie, bien frappée par une guerre, je me sentis qu'il faut réagir tout de suite pour donner aux autres, pour faire partie de la société.
Refugees and activists alike have stepped up everywhere for their communities, for their host communities, for each other.
I believe solidarity is a human responsibility. As refugees, I understand and I know better what is the meaning of a crisis.
In the face of a crisis, humanitarian needs come first. They guide the way forward.
Stopping the virus and offering protection must not be a zero-sum equation. Both are possible, and lives can be saved.
Thank you. To start us off, I'd like to turn first to the High Commissioner for some opening remarks. Over to you.
Thank you very much. I hope you can see me. Yes, thank you. Greetings to all those virtually present, and welcome to this year's dialogue on protection. As you know, and Kelly mentioned, we have held this dialogue, UNHCR has held this dialogue, as we call it, for years now. It is our prime moment of conversation, of discussion with many different actors, with states, of course, our primary stakeholders, but also with civil society, the private sector, academia, and many other interlocutors. And this is a very special year. We all know that. We don't need to remind ourselves. But we wanted, in spite of that, to ensure continuity in this dialogue that has been going on a variety of subjects for many years. But of course, we had to adapt it to these troubled times. We had to adapt it technically, and this is why, unfortunately, we cannot do it as we would normally do it in a big room here in Geneva at the UN headquarters, but we have to do it through a screen. And perhaps even more importantly, we had to refocus our initial plan on the situation that is the context in which the entire world finds itself. And we refocused, as Kelly already explained, on protection and resilience, very important word in a pandemic. So here in the next 4 or 5 sessions, I think 5 sessions, we will really concentrate on the themes that have been announced. What does it mean to be in a pandemic, in particular for the people with whom we work, for the refugees, for the internally displaced, for the stateless, for those who want to return home, for the communities hosting them that share more than ever this predicament? What does it mean for all these people to be in a pandemic? What lessons have we learned? We are already many months now into this situation. Have we learned some valuable lessons? And perhaps more important than anything else, what are the challenges ahead of us? What can we, this is a time of intense reflection about a very uncertain future. And I think this dialogue is an opportunity for us at UNHCR, certainly to benefit from your advice, your questions, your comments, your proposals on the way forward. I just want to share a few thoughts with you just to get the conversation going. Today, this opening session is a dialogue already among ourselves with a number of refugees. I'll mention that in a moment, but I don't want, especially in this format, to speak for too long, but I would like to just have a few reflections about areas that, in my opinion, are keys and would be useful in guiding our discussion, not only today, but in the next sessions as well. First, the set of what I would call core protection issues. As we all know, the pandemic has obliged states, governments, to adopt a number of restrictions, including restrictions in the movement of people. And those restrictions, by and large, are legitimate because states have the duty to protect their communities, their citizens from the virus. But of course, we must ensure that these limitations do not impact negatively and unnecessarily the rights of those people for whom movement can be equal to saving their lives. I'm talking about refugees, I'm talking about displaced people. So this careful balance between legitimate restrictions and the right of people to exercise freedom of movement, to access safe areas or safe countries and ask for asylum, the balance between legitimate measures and what can become abuse is a fine one that would be very interesting to look at. 113 states, this is more than half of the states of the world, have allowed some continuation of the exercise of the right of asylum. This is good, and this is a progress from the initial reaction, which was much tougher on a greater number of states. There's been also some extraordinary example. I've given this example already, but let me repeat it because it's so significant. Uganda, a country without many resources, a country is already hosting almost 1.5 million refugees, has agreed at one point in a few months ago, at the peak of their own pandemic, of their own health crisis, to open the border to allow thousands of Congolese refugees that were desperate to flee from the areas in which they were stuck in the midst of a conflict. They agreed to allow these people to seek safety on Ugandan territory. We work with Uganda on quarantine, isolation, health measures, but what is important here is that they made a very significant concrete and also symbolic gesture, which I think we need to remember. You heard me quoted in the little video. You can both protect refugees and protect the health of citizens and communities. But of course, this is a good example. The 113 states is a good example, but the challenges continue. And our appeal is really those restrictions that are absolutely necessary, let them be temporary. only for the duration of the emergency. And this applies, by the way, you heard Gillian Triggs, the Assistant High Commissioner for Protection, speak in the video. This must apply also to the restrictions that are currently imposed on resettlement by many governments. The second area that I think is worth looking at is the broader impact of the pandemic on refugees, displaced, stateless, and others. The type of impact that, of course, all these people share with the rest of the world, with the rest, in particular with the communities that host them. And of course, the first and foremost impact that must be examined and dealt with is the health impact. I've said it many times, but let me say it again. I think that all states instantly, back in February, March, understood that in designing, implementing their own responses to the COVID pandemic, testing, prevention, isolation, communication, it was important to include everybody, including refugees, displaced, and others. Because if you exclude from these measures any person in the community, everybody else is at risk of contagion or more risk of contagion. So that's very, very important. But it is a good model, a good message that we must pass to the international community. You understood in that moment of emergency how inclusion was important. Make sure that that continues when it becomes a little bit more tricky, when we will have vaccines or cures that inevitably in the beginning will be scarce, expensive for some categories. Let's make sure that these groups are not excluded at that particular point. I'm not suggesting that they should be privileged. That's different. I'm suggesting that they should be included. If, for example, a state will decide, as is likely, that the priority for vaccines should be given, say, to health workers, there are health workers in refugee communities. They should be included too. Not all of the refugees, the health workers, just like the host communities. This is an example of the type of advocacy that we need to promote. Even more complex is, of course, what in my opinion will be the most significant and possibly lasting and unfortunately impactful in a negative way, devastating impact, which is the economic, social consequences of the pandemic. We've spoken many times, many have spoken of a pandemic of poverty, and we know that refugees, displaced, returnees, host communities, stateless people are likely to fall very much in those affected by that pandemic. And the impact is already terrible, especially on the most vulnerable among them. For example, women and girls, they are very much high in our concerns. And this poverty of pandemic has many ramifications, which we will talk about. It affects, for example, going to school for children, especially girls. You've all seen the statistics. Many girls that now cannot go to schools because schools are closed. I'm talking about refugee girls are likely to stay out of schools, even if they used to go to school before, because they have to work because God forbid they'll have to suffer imposed early marriage or even worse type of abuses. And we have also seen a spike in gender-based violence in situation of pandemic and of lockdown. So these are all important aspects, ramification of the economic and social impact that need to be looked at, and not least of them, among them is, of course, something that we have seen, for example, among some Venezuelans in Latin America, but we have seen it also among some Syrians in Lebanon and in other places, people that make the difficult decision to go back home, even if conditions are not yet ready for that, simply because the level of despair in the countries where they're hosted, because of lockdowns and lack of opportunities, that level of despair rises beyond the tolerable. Include the inclusion of these people of our concern and their host communities in the safety nets, in the safety packages that are being planned all over the world, especially for the fragile economies, that inclusion will be crucial for the resilience of these groups. And protection and resilience are the titles of this dialogue. So I hope that the dialogue community, the community around this dialogue, will be strong in advocating for that inclusion with governments, with donors, with international financial institutions, with the private sector, and so forth. And I think that all the work that we have done together in the past few years on the Global Compact and last year in preparing the Global Refugee Forum will be extremely useful at this particular point. And incidentally, this is linked also to another very important theme. If there is no inclusion, the risk is, of course, exclusion. And exclusion is not only poverty and despair. In some places, it can turn nasty and translate into manifestations of xenophobia and marginalizations, which make things even worse. An important consideration that I want to make before I close, this is not an isolated crisis, especially when we talk about refugees and forced population movements. It comes on top of a series of other crises that plague our world, unresolved and lengthy wars and conflicts, growing inequality and poverty, the climate emergency. As you know, or you might know, originally we wanted to devote, before COVID-19, we wanted to devote this dialogue to the climate emergency and how that impacts population movements. We had to adapt, but I'm very glad that there will be a chapter of the dialogue, a session on the dialogue devoted still to the climate emergency, because I really hope that in respect of all these factors of crisis, lessons that we have learned during the pandemic will be applied in terms of preparedness, in terms of how we promote inclusion, in terms of how we plan for response. In other words, that as we discuss the health drivers of this emergency, we don't lose sight of the other important drivers, including the climate emergency. We live, dear friends, in a very, very unpredictable context. And we need to be prepared for further emergencies in the future and not necessarily only pandemics. And finally, a final thought. You all know, I think those of you who know me, how keen I am on both the concept and practice of solidarity. And I say this in full knowledge that unfortunately this goes counter to some of the most common political trends of our times. Me first, my community first, my country first. How many variations of that terrible word first we see around the world? And to counter that, I think that an important message that I hope will come out from this dialogue is solidarity is important. Have we ever been in a situation in our lifetimes, even those of us who are a little bit older, have we ever seen a situation in which solidarity has been more important than now? And I think because now we are all, hit by this pandemic. I'm at home. I tested positive 2 weeks ago. So I'm at home still in isolation. As you can see, I'm not doing that badly, but it is tough. This is a tough pandemic. But when you are in this vulnerable situation, even me, I'm not usually in a vulnerable situation, you understand better the vulnerability of others. And therefore, you understand the importance of sticking together and working together. And I also want to recall last year's Global Refugee Forum. In the past, we had the dialogue every year. Now we will have 1 year the dialogue and 1 year either the full forum like last year or what we call senior officials forum, a more technical version of the forum, which will be next year. So the forum and the dialogue will continue to talk to each other, to have a dynamic between each other. So let's recall last year Global Refugee Forum. the main focus was really the global compact focus, a whole of society approach to responding to forced displacement. And the whole of society approach is founded on solidarity, can only be founded on solidarity. So the two go together. And this is why, thinking also of the strong push for refugee participation that we heard loud and clear throughout the forum last year, all the way to the closing session, if I recall correctly, this is why we have decided to open the forum this year in a dialogue between the Deputy High Commissioner, myself, so the management of UNHCR, and a group of refugees, but not any refugees, refugees that have really engaged themselves in the support of their community. So refugees that represent, on the one hand, more than anybody else, better than anybody else, the whole of society approach that we want to promote, also in responding to the pandemic, but also refugees that symbolize that spirit of solidarity, which I hope will continue to underpin everything that we do. Thank you, Kelly.
Thank you very much, High Commissioner. It's a great way to get us started in this dialogue, particularly those principles of solidarity and responsibility sharing, which are the heart and soul of the Global Compact on Refugees. And we have some very dynamic participants this afternoon. And one, in fact, I think is in my neighborhood. Shadi, we're going to turn to you first, please. When the disaster struck in Lebanon, you started an initiative that raised $30,000 for the emergency response from the blast. And throughout the pandemic, you have organized the neighborhood, gone above and beyond to help vulnerable people here in Switzerland be able to get groceries and find other ways, particularly during the lockdown earlier this year. Can you tell us more about these initiatives and what compelled you to step up?
Thank you very much. Thank you very much for the question, for being here. Allow me to start by thanking all attendees, all the UNHCR awesome team who've been for years our voice as refugees and who's been amazingly organizing this event, supporting us during the process of organizing Dear Refugees, UNHCR team, Madam Deputy High Commissioner and Mr. High Commissioner. It's a pleasure to be with all of you. It's a true I think there are many refugees everywhere that stepped up and acted and engaged during the pandemic. During this year, we've witnessed too many. And nevertheless, allow me to stress on a fact that others, the non-refugees, have as well acted and supported. For me, it's important to stress on this point because it proves that there is no difference of nature, but the difference is rather on the conditions, on the vulnerability. As Mr. High Commissioner said it, when we are in the vulnerability situation, we understand the others, and those who've been in a vulnerability situation understand those who have become now in a condition of vulnerability. So the difference for me is the conditions, the administrative status. Yet it's important to acknowledge a reality, in my perspective, that being a refugee, it would no doubt mean that I've been through a crisis. That's why I could say as refugees, we've been and we've learned from previous experiences, previous crises, that in the time when a crisis hit, we need to count on one another, to support one another. Last August, when I saw the blast of Beirut through my phone, I saw too many videos. We all remember how many videos, how many cameras have filmed that. I however, did not hear the boom. I instead heard my father's words too many years ago, may he rest in peace now, when he said, as we were watching on a screen another crisis, he said, when a crisis occurs anywhere, you need to know that we are all, directly or indirectly, its victims. It hits us all as a human. It hits you, my son. And as his son, this is the word I was hearing when the blast in Beirut. I saw those seeking medical care. I saw later, after hours and after days, how many states and NGOs and individuals stepped up quickly and started supporting, in particular, health system and hospitals. And as myself work in a medical relief NGO, I know how much important is that. I know how essential is that. I know how that saves lives. But as a refugee, I started immediately to think of those who lost their homes, those who from 1 second to the other, have no sleep, no place to sleep the night. Those who are injured in the hospital, who will leave in a week, but will have nowhere to go. And that's why I immediately approached, or soon after approached, some friends, refugees like me, who know what exactly it means to be suddenly without a home, who know what it is to lose your home, to lose your safe space. And everyone, honestly, and I assure you, everyone I contacted, 20, 30 people, or even more, everyone said will do anything in his or her capacity to support. I then approached the UNHCR team, who were, as expected, amazing, supportive, extremely supportive. So we launched the campaign. It's thanks to everyone who joined in the campaign itself, everyone in the UNHCR team who supported it. Now, the other initiative that we launched in Geneva, in Versoix, and in other places in Geneva, to support our local communities at the beginning of the pandemic, it also pays on the same faith, the same values, the same concept. In fact, we heard how people at older age are more likely at risk. And the fact that daily life could be changed is something we know as refugees. The fact that the simple things could be difficult and challenging and risky is something we know as refugees. And that's what somehow brought the idea to our heads. And that's what allowed us to quickly mobilize one another and to start a group that will support those people who we considered vulnerable during that condition, during that moment. And that's how we support it. But allow me, before ending this, to stress on one point. It's true that everyone says we supported our community, we supported vulnerable people, we supported all people. But I need to say that, in fact, those people who accepted to be isolated, who accepted to be between what we say four walls, are the ones who as well supported us, protected our health system, protected our community from the pandemic, and protected in particular the hospital that I, in any moment, with or without the pandemic, might have or the need to access it. My daughter, my wife, my mother, everyone. So thanks to them, they accepted to be at home and allowed us to bring the basic little tiny things of tomatoes or post or medicine. Thank you.
Thank you. Thank you so much, Shadi. Really inspirational. And I think you have lived. We're all in this together. I'd like to turn next to Niall, if I could, please. So many refugees are using their expertise to find better solutions for their communities. And as a trained communicator, you've used your skills for good in Kakuma, in the refugee camp, one of two large camps in Kenya. Can you tell us more about your work, Niall, and how you gained your expertise and your passion for this?
Thank you so much, Kaylee. I'm so glad to be part of this and to help inform this year High Commissioner dialect. Thank you so much for the opportunity. And I always believe that young refugees should have the table. They should not just have a seat on the table, so that you came to understand what the real journeys are. And I'm so glad that the High Commissioner is committed to making sure that young people like myself have a seat in the table, and that we even have the table itself to make sure we inform the work of UNHCR. 10 years ago, I was forced to flee my country. And today I could still remember that fateful day very well. I was lost, I was devastated, and I was frustrated. Coming to Kakuma refugee camp, I've been able to find hope and peace here. And every single morning, I remember waking up at 5 a.m. to go to school. I walk 5 kilometers to reach my school. And education give me the tendency to keep moving forward in life and look toward a future filled with hopes in the face of all the challenges I was facing every day. I was able to enroll in several courses and gain skill in communication, gain skill in social media marketing, peace building, IT, human rights, and social entrepreneurship. And this skill have enabled me to initiate several programs in the camp. I've initiated refugee peace ambassadors that help young people who have been traumatized by their journey to be able to heal from their trauma, to be able to build their resilience through mentorship, and to be able to enhance peaceful coexistence in their communities. I've been able to engage with Amala, a global high school for refugees that empower young displaced people and the host community to become agents of positive change and social transformation in their communities. I help facilitate courses in English, I facilitate courses in ethical leaderships and peace building. And I've been able to support the initiative of Take Action Global, where we have set up an innovation lab school in the camp, helping young people from the refugee community and young people from the host community to be able to gain digital skills that help them to be part of the job market and to help them even be part of the evolving market. And I've been different part of Kenya where I've engaged in training young people in digital skill, helping them to craft innovative solutions to challenges in their communities. And I believe that, and we have all seen that enabling refugees to gain skill help them not just to break away from the cycle of dependency on humanitarian aid and become self-reliant, but it also helps them to contribute to the host community in so many ways and be able to help local economies grow. We have seen in Kakuma with programs like Kids Day helping the host community and the refugee community to be able to flourish. We have seen Kakuma having an annual economy of $56 million, which I think is something that can be scaled and boosted so that refugees and the host community can have a fairground where they can also make a living just like anybody else. One thing that's really important that I think should be prioritized is that as much as young refugees gain skill, this skill should be tied to opportunities in employment and making sure that these young people are able to start a business when they gain these skills so that they can contribute to the host communities. We have seen refugees taking part and contributing to the host communities all over the world. Thank you very much.
Thank you very much, Niall. You can hear the enthusiasm dripping from your intervention. You're a wonderful model of someone who's really taken his talents and his interest and made the most of it. And indeed, Kakuma is a very special place, particularly the relationship between the refugees and the host communities, both benefiting economically. Thank you so much. Can we turn next to Hindu, please? Hindu, you advocate for the inclusion of indigenous voices and knowledge to benefit the world. How do you think that we can make sure that those voices are heard and that they can contribute, and why is it so important?
Thank you very much. And hi, everybody. It's really a great pleasure to be with you and talking about displaced and refugee peoples in this time of pandemic. Of course, for indigenous peoples, let me remind you first, we are 5% of the world population and protecting 80% of the world biodiversity. So that makes us vulnerable and frontline of all the environmental degradation we are having. And that's also make the link to what the High Commissioner said, climate change can be also the cause of the displacement of many peoples. And some of them become a refugee. Maybe it is not the terminology that you are using in this context of the institutions, but it is what the people experiencing in the ground. However, with all this impact we are living, adding to the COVID, it's become a most vulnerable communities, again, plus. But we do have also a solution, because that's why we are building our resilience and then helping our peoples to live in harmony with the Mother Earth. And that's what you call the traditional knowledge of indigenous peoples. I'm advocating for and then asking for the voice of those peoples to be here. So indigenous peoples do have a traditional knowledge from the different landscape we do have. From the forest to the savannas, to the deserts. And one of the examples can be around the Sahel, where my peoples are living and where there is a high level of displaced peoples due to the conflict or due to the resources that shrinking and people's fighting to get access of it. So we observe our Mother Earth, the wind direction, the displacement of the birds. We observe the position of the cloud. We observe all our animals, our cattle, and that gives us the concrete information to see from which place to which place we have to move and where we have to stay and how we can cope with our ecosystem that's shrinking and how we can live in harmony. Even we are the most vulnerable and impacted, we do have those knowledges. And this is a big reason to give a place and a space for the most vulnerable, for the indigenous communities to sit in the tables to the decision making. Because when we take the decisions in our life, it is concerning our environment, concerning about how we are defining our futures all. The response that giving during the crisis, especially in my region around the Sahel, it's firstly the gun because of the security. Secondly, humanitarian, because the urgent needs. But we all know that never a bullet full a stomach of someone. And that's why they have to move to find the food, to find the safety and security. That's why they become displaced peoples. That's why they become a refugee. And when we act in all the first emergency, it's still the first emergency solutions. It cannot be sustainable. It can be only for a short term. But if we take the voice of indigenous peoples, when we are designing the plan, the program of environment, of security, of development, and then those peoples can say them what they can build for the long term. It is the same for displaced peoples. It is the same for refugee peoples. It is the same for the indigenous peoples. We need to rebuild better all together. And we cannot do that if we do not sit in the tables of the decision making in a different level. And thank you so much, the commissioner, to be here with us, and then to committed to stay for all the panels in order to discuss with all the different peoples, because that's how we can begin the real involvement of those who are left behind. We cannot achieve the SDGs and include everyone and be partners if we do not listen from each other and understand what we are living, how we are living it. So we do have the solutions. We want to have the voice. We have the reason to be in the tables. And I think as partners, we can all build better differently. Thank you.
Thank you, Hindu. You make a very good case for this, and I don't think he would miss a word of what you're saying and other panelists. So thank you very much for that. Just a reminder to participants, please do not be shy about putting in questions in the function down below, and we'll try to get those to those either today or to subsequent sessions. But High Commissioner, can we turn to you for a bit of commentary on what you've heard over the last few minutes?
Sure. I think what we heard, frankly, doesn't need a lot of commentary because it comments by itself. It was really, I just had, I was jotting down as Hindu was speaking, just a few things that came to my mind. One, how very rich the debate can be if we have people that have gone through this experience talk about it, as opposed to others talk about them all the time. So this is just an obvious comment, but it came, listening to Shadi, to Nayal, to Indu, this came very, very strongly. Second, Hindu raised a very important point. I mean, she's talking about indigenous people. This applies to all communities that risk suffering marginalization. She talked about participating in the decision-making table, sitting at that table. This is something that I've said it many times in the executive committee, in the previous dialogues at the forum last year. This is something that we're making progress on, but still very complicated. It's not easy. It's not easy. How do we ensure refugee participation in our debate? Now, we are doing it now, but we need to become more systematic, and every experience like the one of this dialogue is further lessons, and you need to help us get there in the best possible way. Third, Shadi made a very important point, which is refugees like him or former refugees are people that know about crisis. And this is something that we should never underestimate when we are all in a big crisis. So let's try to tease out of our discussions today and in the next few days this experience and bring it to the world and show that they have, among many other things, refugees, people that have suffered crisis, have this to contribute. And finally, last but not least, we just heard it, a reminder about the ultimate SDG objective, leaving no one behind. We deal with a population, with populations, with communities that are at high risk of being left behind. So if we're serious about pursuing the SDG, the Agenda 2030, we have to commit more. Thanks, Kelly.
Thank you very much. Let's turn, if we could, to Dr. Carmen Parra. Dr. Parra, if I can ask you, your experience witnessing how people who are forced to flee working to meet the protection and resilience needs in their own community. Can you talk about your own path to rejoining the medical field after you found safety in Peru?
Hola, buenos días. Hello, good morning. Hi, thank you very much. It's a great pleasure for me to be here with you today. I'm very, very grateful. Very, very, very much grateful. It is a great honor for me. I'm very grateful with the UNHCR team here, with all the girls who are supporting me here. Yes, I am a doctor. I am a gynecologist, obstetrics. I've had a 10-year experience as a doctor. I studied in my home country in Venezuela. I studied at Carabobo University there, where I had some problems. I faced some issues in my country with regards to my family. I lost both of my parents. I also lost my husband, the father of my babies. I was alone with my 3 children. And because of the crisis which unfolded in my country with the shortage of medicines and food, this led me to flee my country. And then I decided, because of everything I've just explained before, together with a friend of mine, my friend Jolia, my 3 children, we decided to flee Venezuela. And I am here. I've been living here for 2 years now. When I arrived here, things were very, very difficult, very complicated, because I had started from zero. So I arrived here in Peru and I had to do a little bit of everything, really. I worked as a waitress, I worked as a receptionist. I had to go through several jobs, which were very hard for me because I wasn't ready to do these kind of jobs. And I really felt very bad because I was doing so many things that it wasn't really what I was trained for. I studied for so many years to become a doctor, and then I found myself here just with my children, with my friend. It is very hard, really, to have to adapt to a new culture, to a new climate. It was very, very, very difficult. After that, obviously, not everything is bad, I have to say. Thank God. So I managed to get in touch with the UNCHR and the NGO, and through them, with these wonderful angels, that's the way I call them, they are angels, I managed to get this ministry here to recognize my qualifications. So only then I was able to work here in Peru as a doctor. So this took me more than a year to deal with all these paperwork, to have all this paperwork done. And now, for a year, I've been working as a doctor here for a year now. I'm so happy, and I would like to thank you all. And that's why I'm here today. Thank you. I'm here thanks to you as a doctor now. I can talk to you as a doctor here in Peru. Thank you.
Thank you so much. We're delighted you're with us as well. Thank you, and we're glad to hear the brightness at the end of that story. Can we turn now to Bartholomew, or may I call you Bart? The world has seen so many communities around the world become more vulnerable in the face of the pandemic. Bart, you know that we've received a lot of questions already in anticipation of this particular session about the socioeconomic consequences of the pandemic, livelihoods that have been lost. The High Commissioner mentioned this in his opening remarks, and access to education has been difficult. Can you talk about how COVID has impacted the lives of displaced people, especially those that were vulnerable even before the pandemic?
Yeah, thank you so much for this opportunity. And I can say you pronounced very well my name, Bartholomew. Thank you so much. You all agree that displaced people are battling the same virus as the rest of the world, but they are still facing greater challenges with less access to common solution. The following are greater challenges. Everyone is under lockdown, but for refugees, they are confined to the camp since March up to date. There's lack of mobility. There's no way for a refugee to move from point A to point B. There's not enough opportunities to livelihoods or resources typically used outside the camp. And this leads refugees to be exposed to the poverty. Food and other goods are now very, very expensive. The decrease in possibility of self-reliance many refugees previously enjoyed. And this leads refugees and displaced people to rely only on donors. There's less access to health care facilities. I can know many people are now really putting more attention only on COVID-19, but yet there are other diseases like malaria, like coughing. The important services previously provided in camps temporarily suspended. For example, in Zimbabwe, the government civil documentation exercises, and this how a refugee can have access to open a bank account, how a refugee can have access to essential service. And here are some of the fewer solutions. Schools have been asked to close for safety without any alternative. Social and sporting activities important to mental and physical health of youth are disrupted. And you all agree with me that this will lead refugees to be exposed to high risk, like they'll be exposed to the juvenile delinquency, they will be engaged in drug abuse, in early marriage, early pregnancies. Yeah, and then there are also the previous methods of communication and community consultation offered, which cannot occur just to curb this pandemic. And let me end with this point of the internet access. Let me ask to, if maybe the audience may allow me to ask them the question. If I want to know the positive impact of COVID-19, I know most of the people, they will just say, we now have the ability to work and to study from home. But now my question is, do refugees, do displaced people have the ability to work, to study from home? Can I repeat again this question? Do refugees, do displaced people have access or have the ability to work and to study from home? Let's reflect on this. Thank you so much.
Thank you, Bartholomew. Really appreciate that. And connectivity is such a crucial part of our work, and particularly during these times. Dr. Feza Hosseini, if we can turn to you next, please. You're both a refugee and also a physician in Iran. We've received lots of questions, again, in preparation for this dialogue about integration of refugees in a local context. Some of the strategies that might be in place, the cooperation that you've seen between local authorities and local actors. Can you talk about the benefits, the importance of allowing refugees access to national systems of support?
Hi everyone, and I'm really happy I'm here with you today. I'm really proud to be here today. I genuinely hope that this thought process that we are having could be helpful to everyone, and hopefully we can see a world without this disease. As you all know, a refugee. I'm a refugee living in Iran. I came here from Afghanistan, and I've been using the services provided to me in Iran, and I could get to where I am today. And I am working at a health clinic, and I'm doing my best to help the host community and the refugees in the city where I work. You asked me about the access to healthcare system. I think as a refugee, what really matters to the refugees is the insurance that the refugees need, because it's really vital for people so that they can prevent contracting the disease first. What I can really emphasize here is that in host communities, and because of the problems, of the basic problems they have, they usually don't think about other issues like the insurance. What we are trying to do is to tell them how important it is for these refugees to have this insurance at the same time, because of the economic hardship refugees here in Iran are facing. Unfortunately, the issue of health and education is no longer a priority. It's been set back, and people are first priority for people is to bring bread to the table. And what we do is to give them the information they need, basic information about their health issues through the Ministry of Health in Iran. During this coronavirus pandemic, what the health system here did, we tried to reach out to these people through phone calls. And what we did, we wanted to make sure we prevent these people from getting the disease. And then we told them about the symptoms. We told them what symptoms they would get, and make sure they're not spreading it. And once they got it, we went in, we helped them to get over the disease. This is not a one-sided event thing. It's not just Iran doing this for its citizens. I made sure that these services are also provided to the refugees as well. But let's not forget, as I said, health is not a priority for these people. It was the refugees who didn't help us in the beginning, but we insisted. We gave them calls all the time, and we managed to get some sort of trust and hope within the refugee communities here. We had a lot of people, refugees, mostly Afghan refugees, coming to the health clinic where I worked, and they became members of this health service. They gave us their numbers, and we made sure we have access to them if something happens to them, so that we can help them later on. And also other services, including vaccination of kids, and also for pregnant women. What I really think is paramount is that this can be done in other countries as well, because I know that refugees in many countries, that they do not have enough access. Sometimes they don't even have access to telephone in some countries.
Thank you very much, Dr. Husseini. Important comments. High Commissioner, we've heard now 3 great examples of the value of inclusion, particularly inclusion in local systems, national systems, from Dr. Para, Dr. Husseini, and from Bart as well. Comments on this before we go to some more questions and inputs from our panelists.
Yeah, again, 3 very inspiring reports back to us. I had 2 different tracks of thoughts. One is the very high risk of exclusion that the pandemic presents. You know, I was thinking, it's like the risk of the lockdowns are that some people are locked out. And this is much worse than being locked down. This is what I think it was Bart who said, you know, if you cannot work at home, you're not locked down, you're locked out. So this is what we must absolutely work. And I think what Dr. Fezet told us is very important, that even in countries like Iran, where amazing progress occurred in the past in terms of refugee inclusion, one of the most advanced countries from that point of view, in education, in health, the combination in that particular case of an economic pressure, economic crisis, and the pandemic can generate fresh exclusion, which is very, very dangerous and very bad for many people. So we need to absolutely look at this inclusion theme. To me, this should be one of the key threads of the dialogue, inclusion. And this includes, of course, and you mentioned it, Kelly, connectivity. It can be very technical in some cases. In other cases, it is about policy and law. In other cases, it is about availability of inclusive opportunities and so forth. But on the other hand, just quickly, there is, it is also true, I don't want to be optimistic at all costs, but since this is the opening session, the pandemic is also a formidable opportunity to show that not only refugees, other people on the move can be included, but when they're included, their contribution is fantastic, is so important in a situation like this. I mean, we heard it also from all the other speakers before. Carmen, tu testimonio fue fantástico, muy interesante.
Your testimony was very, very good. It was fantastic.
I think that it's about skills that these people carry with them and can be put to the best of use at a time when these skills may even be in short supply. We've all seen, even in rich countries, in industrialized countries, during the pandemic, a shortage of medical personnel. How many examples have we seen, and we heard it from Carmen, from others, of refugees, other people, migrants, people on the move, saying, I'm here, I am a nurse, I can volunteer in a hospital. And this is very important. We may all 400 people following us here now know this, but many people out there don't know, don't believe it. They actually believe the narrative that refugees come to steal our jobs. So can we use the pandemic to turn around that narrative with concrete examples, as we have just heard?
All right, that's a call to action for all of us, certainly. I want on this note, because it's a very good segue to the next question that I have for Bart, which is some examples that he has, particularly with the vantage point that he's been such an active member of the Global Youth Advisory Council, how refugees are mobilizing in their communities to respond to the pandemic and the challenges they present. What are some of the successful initiatives that you want to tell this group, and perhaps we can build on?
Thank you so much again, Kelly. Prevention, may I say it again, prevention. Refugees communities are stepping up to improve prevention and address issues caused by the pandemic. But remember that there are still some gaps and needs which need to be addressed. The following are the adaptive COVID-19 prevention measures. These include the awareness raising campaigns conducted online by young people and the information sessions. Young refugees are now actively engaging in the clothing mask production. And there are also availability of community groups for wash and health. And sometimes what refugees do, we usually identify the problems caused by the COVID-19, and then we come up with solution. As a response to the food scarcity due to the limited options and rations, what young people do, they usually train the community on how to manage food for the best practices. And as a response in the increase of GBV or gender-based violence, this focus on community support groups and information sharing. As a practical example, there was a virtual training on engaging men and boys in accountable practices to prevent gender-based violence against women and girls, IME projects, which is still ongoing, being implemented in Tongogara refugee camp. And this is a good practice, and it has also a positive impact. And as a response to the increased vulnerability of groups already most vulnerable, there's availability of community group and information sessions on child protection and person with disabilities. And as a response to the youth without access to education, social and recreational activities at high risk for mental health issues and unhealthy behavior, young people are now working in close collaboration with UNHCR and other partners to create alternatives and use technology to support COVID-19 response. And as a practical example, because I always want to support my point with an example, the International Day of the Girl event was conducted online, and this was really very successful because we could reach out to many refugees, even UNHCR staffs, other partners could attend. And as needs, I would like also to address this need to increase the access to internet and virtual spaces. There's need also to create alternative forms of education and the promotion of mental health and well-being of refugees and asylum seekers, and the increased variety of livelihoods opportunities, strengthened opportunity engagement, especially including children. And to close this speech, I can say COVID-19 pandemic may be here with us longer than we wish, but what I can advise you, we just need to adapt and address the needs and challenges unique to displaced people. Thank you so much, Kelly.
Thank you, Bart. Community outreach, technology comes through loud and clear in this response as well. Thank you for that. Niall, I'm going to come back to you and ask you a question, but when you respond, a slightly less energy and a little bit slower so we get every word. Another issue that I know you know very well of the pandemic is the threat of widespread misinformation. In fact, the UN has launched a campaign related to this. Can you talk about some of the innovative ways that you're fighting misinformation in your context there in Kakuma?
Thank you so much. We have seen that misinformation has been a challenge all over the world, and that is the same in refugee camps like Kakuma, where I've been living and where I've been working. And when the virus first hit Kenya, the main challenge I see in the camp was fear. Everyone was scared. People feel, oh, this is now coming to kill all of us. This is the end of us. And that fear often creates tensions among communities. And sometimes it can lead to conflict when we have misinformation and rumors circulating in the communities. So from my experiences, there are 5 things that we thought were really crucial in fighting back the widespread of misinformation and rumors. The first one was mass awareness. That was the first step we took. We came up with posters that we put across all over the camp. We initiated a digital education program to make sure people are well informed. And from there on, we move on to communication channels. How do we get this information to people? The first thing was making sure these communication channels are accessible. We look into the methods of getting information and maps 500 shops across Kakuma and Calabria where we put posters in different languages, and that incorporate our language barrier because there are people who don't understand some languages. So we put posters in 4 different languages that are mostly spoken in the camp and the neighboring host communities. And the other thing when you talk about communication channel also is trust. Are these communication channels trusted by the communities? So we work closely with community leaders and religious leaders who are mostly trusted by their communities. And the third component is fact-checking system. So we came up with, put in place a platform that has been used all over the world in different places now to fight misinformation called Weak Rumors. And what we did is that people can report rumors to us throughout. We have a toll-free number that they can send messages in, and we work on those rumors with relevant authorities in the camp, and UNHCR have been very supportive in this, especially the communication unit in Kakuma, who have been helping us to verify some of the rumors that have been coming into our system. And what happens is that when these rumors come into our system, we work on them as soon as we can, and we try to send a counter message before this information can get to all members of the community, so that we try to break that chain of supply. And the other component is community engagement. We initiate a community ambassador program where we train a team of refugee youth and members of those communities in countering misinformation and deploy them across the camp and across the host community, making sure they work day and night with the communities. People can easily access them.
We may have lost Niall just temporarily. We will come back to him, but I think we got most of his 5 points in terms of misinformation. Very, very well received. And if he has a final point, I'll come back. Can we turn please to Dr. Faza Husseini? As you are a medical professional, this is a nice segue to the last point that Niall was making. one of your main COVID outreach initiatives focused on communication, in fact, trying to get the information to the people that most need it. Why is this important? Why was this a priority for you?
ببینین به این دلیل because we want people to have all the information, and in the community I live in, knowledge is power, and knowledge is what we need to give them, and we in this country, and I think, and I'm sure in many other countries, the first point of contact and the first channel of information is TV, and we're dealing with refugees here. These are people mostly who are they do have access to TV, so we've asked the TV channels here to give them the right information. And I think the first thing is to tell them what the symptoms are and also how they can prevent contracting the disease. And I told you before, what we really did is we opened a channel of communication with them. We made sure that at those times they have access, they're not at work, they have access to telephone. And also we had the virtual channel of communication. We could use that for the people who spoke a different language or a different dialect, and we also needed to inform them because they live in this society. So we had difficulties in the beginning, but then we overcame, and as your other guest said, we also had the same approach. We invited them to come forward. We talked to religious leaders here. We talked to them, and we informed them how they could contract the disease and how they could transmit it to others. These are things that are very simple, but for these people, this is really essential. And I think what we did was really useful to them. We did make a big effort here to make sure that we are informing the highest number of refugees, and the refugees are using this information to overcome this pandemic.
Thank you very much, Dr. Feza. I'm hearing a theme here, High Commissioner, in terms of community engagement, outreach, in terms of the strategies that Niall, Bart, Dr. Feza have just mentioned. How, in terms of fighting misinformation, miscommunication, in your experience, how can we use some of these examples and amplify and scale those up in other contexts in which we're working?
Actually, I had quite a number of thoughts, but maybe to distill a couple of them. One is this: the best counter to bad information is good information, right? Is factual, and it's amazing what we heard from Dr. Feza, for example, now, but also from the other speakers about, the effort was really the vital effort to give the right information to people. So the virus is not there to kill us all, but it is dangerous. So wash your hands, keep your distance, all the things that we have learned. This has been an amazing period for the whole world to learn about communication and the importance of honest, factual communication. And I think that all of us, not everybody, because there's a lot of misinformation going on, but all of us are beginning to understand more instinctively what is useful and factual and true from what is manipulated. And I think that this is an important lesson that we need to continue to learn. The other one, however, I wanted to bring the discussion even further to 2 points, more general. One is, we heard from all, Bart, Nayal, Dr. Feza, the importance of communicating to exposed communities by members of the communities itself. And I'm wondering whether this should not be a more important entry point for us when we talk about refugee participation, community participation. The pandemic once again has put us, has stripped us of all unnecessary infrastructure. In many places, we could even not go anymore to the refugee camps. Look, in one of the biggest refugee camps in the world, in Bangladesh, the government, and rightly so, because it helped preserve those camps from the pandemic, imposed a very strict lockdown, and very few humanitarian workers could go in. So we had to rely on the community. I think we need to build on the phenomenal lessons that we heard about just now and that we've had in the field. Can this be really a better way to work with the community, to put the community in front when it comes to reliable information? Refugee communities are rife, unfortunately, with rumors, with conspiracy theories, with false information, and I think that this is a way to address that. And the other and concluding comment I wanted to make is that, unfortunately, when we talk about refugees, migrants, displaced people, there is also a whole lot of other false information that is spread. The false information, like I said earlier, of the unscrupulous politicians that manipulate this issue, say, oh, these people are here to steal our jobs, to threaten our values, to be terrorists and bring insecurity. This is all fake information. So the lessons we've learned on how to use information through the community, to the community, but also to the host communities as well. Let's learn those lessons and let's try to use them to counter also not the bad information about health, about the COVID, but the bad information about population movements that has polluted the work that we do for the past 5 to 10 years.
Thank you. Thank you very much for that. I want to turn back to Shadi now. Shadi, you talked a little bit about your work with your medical relief organization, which is helping refugees now around the world. Can you talk a little bit about your work now in real time in terms of the pandemic, which obviously we were already dealing with record numbers of people displaced, forced from their home, but this obviously adds considerable complexity. Shadi, over to you.
Thank you. Allow me to start by a very brief background. I work for Awesome. That's how we like to call our NGO. It's a union of a group of NGOs based in a dozen of countries, founded by a diaspora doctors. And it's interesting that many of those doctors have been at some point in their lives refugees in a way or in another. Although Awesome works on providing medical care and relief in conflict areas to those affected by conflict, and in coordination and supported by UN agencies, WHO, states, NGOs, private sectors, individuals, we've been able to offer services to a number of beneficiaries that equals about the Swiss population only in the past decade. The work of Awesome is mainly relief, but what is interesting, again, to mention another point interesting, that the fact that these doctors, the founders, and the workers belong to different cultures, live in different countries, in a dozen of countries, have allowed to benefit the union, the NGO, to enrich it through intensive and practical cultural exchange. And allow me also to mention that Awesome considers development in all its relief activities, such as operating hospital by solar energy in one of the most dangerous places in the world in northwest Syria, or training local staff, which been done for the past decade, for many years. And here is the point, empowering women by training them to become community health workers and offering jobs, with too many objectives for the project when we initiated that 3-4 years ago, but that didn't include COVID back then. Overall, we try as well through technical and medical communication between the medical community to build bridges seeking peace, because peace is the way to go back to our communities, to our original communities. Anyway, during the COVID, we've developed together with partners, with the WHO, with Health Cluster, preparedness response plan, and since then we've been working intensively on many fronts. The severe humanitarian needs in one front, as you just mentioned, threat of the virus in the other, ways to protect the medical staff who are first exposed to the danger of the virus, ways to inform and raise information to get the accurate, the right information, and to then communicate it. So we have established facilities, strengthened other facilities, raised awareness. But what is remarkably interesting, what is really interesting, powerful, is the role of the community members, as Mr. High Commissioner just said it. In particular, the community health workers that have been trained in the past, not for the purpose of the COVID-19, but in my personal point of view and in this year experience, these women, 600-700, have been the first and the best wall against the virus. They've been our giant mask that protected us, protected the community, gave us a space of time to be better prepared to face this pandemic. These are the people who could raise awareness. These are the people who are trusted by their communities. These are the people who, as Mr. High Commissioner said, and as Dr. Hosseini said, who belong to the community and who have the accurate information, especially after being trained, after receiving the right information. So they spread this information in their communities, in their camps, and they were the first point of response to the suspected cases before it gets confirmed. To end this long speech and these points, which is brief but shows few strong points that we've learned, lesson that we've learned. I need, after listening to everyone here, I feel somehow obliged to admit, to confess that few years in the past, when I found myself becoming a refugee and having no other choices, and it was a difficult choice to even ask for to seek the asylum, I was somehow feeling ashamed. No sense, no logic, but a personal human feeling. Feeling less than the others, the non-refugees, for no reason, but it's again a human feeling. Back then I had this feeling. Today, after listening to these experiences, to these amazing people from around the world, thank you for putting us together. I certainly can be only proud of this population who proved to me and to everyone in the world who wants to listen that the previous experiences, that the path we've been through, including the crisis, is being used for the advantage of our humanity, of our future, of our children. So thank you all for sharing all this information, for being an example, for inspiring us. Thank you.
My gosh, Shadi, you're inspiring us. Thank you for all of that. And OSOM is an organization I know that's grown quite a bit recently, with not just in Syria, as you mentioned, but Bangladesh and Yemen as well. And I think we'll carry that image of the giant mask with us from this session this afternoon. Dr. Carmen, can we come to you next, please? Obviously, you've been on the front lines as well with the coronavirus in Peru. Can you talk a little bit about your work and how you have coped in this most unusual environment over the last months?
Yes, of course. I would like to share my experience with you. Well, at the beginning, because I am part of the team of the first response team, it started about 7 months ago. That's what's the beginning of my work. I work for a public owned or state-owned hospital, and we are a team, a very cohesive team. It's not only us medics in the team, we also have the technicians who are facing the highest risks because they have to take the sample of the patients to diagnose the patients really with COVID. And also we have the people or the cleaning staff, I mean all of them who belong to our team. We've been a great team, and we've been giving this type of service which had been very dangerous throughout all this time. And thank God, God has kept us all together and in one piece. Because in some personal cases, I've had colleagues who had passed away, and also some relatives of my colleagues who had passed away due to the high numbers of cases here in Peru, and also due to the complications from COVID. Some people of my friends and families of my friends had passed away. We basically have seen 70 to 80 patients daily. We had a number of patients, about 9 to 10 patients who had to be hospitalized. And obviously, we also had a huge number of people who passed away. It is very sad, really, very sad to see so many families mourning and going through bereavement because they had lost their grandparents or older people of the family, but also young people, which really has a very important impact in our personal life. I mean, every single day I have my personal battle really to fight because back at home I have my 3 young children and my friend, and I really have to take very good care of myself. It is basically that protection, safety, and to be very balanced and to try to keep a good balance and to be a positive contribution really. And in our daily experience, we've given the best of us, and today we are still in the fight against COVID. And the most important thing I would like to use this opportunity to tell you all who are listening to me right now, I would like to tell you what we are. In my case, I am a Venezuelan doctor in a different country, which is Peru. So we are a great support. And we are together really to give the most positive contribution and to give the best of us to all of you. Similarly, if we were in a different country like Argentina or Chile or in any other country, the most important thing is that we are always here, wherever we are, to give the best support and our positive contribution in face of this humanitarian crisis that we are all suffering. Obviously, it depends on each person's particular case, but in my case as a doctor, I'm much focused on the health-related issues. I'm more working on the service of the respiratory screening program. Some people look at us because we have to wear all these different suits, and people say that we look like astronauts. It's very hard to work with this suit and these masks because we wear all these different layers of equipment, and we have in the 3rd layer, we use a special mask, we use the goggles, we use the another masks. It is very, very hard really to conduct our work wearing all that, but with the great satisfaction that with the passing of the days, we've seen an improvement in a positive way because we can see a reduction, a very significant reduction of cases of patients infected. We still have some patients, but the number had been reduced. Also, I would like to ask you to please try to keep the biosafety measures, take care of yourself, so we can really put an end to all these, and we will have to stop crying for the deaths. So I would like to really encourage you to take care of yourselves. I feel very well because I've been working in this team for 7 months already and I haven't been infected. I'm very healthy. My children are very healthy. My family also is very healthy. So yes, we can. Yes, we can. It is possible. We have to do our bit. We have to really take care of ourselves. We have to take care of ourselves to be able to take care of our loved ones. Also, I would like to reiterate my acknowledgement and to thank you all for your patience. And that's it. It is a pleasure. It is an honor. Mr. Filippo, thank you very much to all of you. Thank you. I feel very well. Thank you very much for everything. And that's it. Let's stay safe and let's take care of ourselves because this is not the end of COVID. I mean, it hasn't ended.
Thank you, Dr. Carmen. Spoken as a true physician. We need to take care of ourselves. And indeed, I think, unfortunately, you are also right that we have not seen the end of this. So we need to take care of ourselves and take care of others. Thank you for your very personal story. Can we turn now to Hindu, please, and ask you about the intersection which the High Commissioner mentioned with regard to what we can learn about from the pandemic that we can take to climate action and climate change? And how do you think that what we've actually been able to do in terms of preparation response will help us on the preparation with regard to climate?
Right, thank you. It's really so great to hear from all the previous speakers that I wanted to share that first. And also, I don't know if you saw the tweet of the UN General Secretary, Antonio Guterres, who said that the Central Sahel is at the breaking point with the violence that rising. Families is facing hunger, poverty, losing of livelihood, and COVID, it's making the things worse again. He said, in addition, we will have like 13 million people that need humanitarian assistance. So that means also we have the COVID who can be a learning point for all of us. Because when COVID came, overnight, the world changed radically. We all learned how to live differently and how to protect each other. But still, the inequality and exclusion of the most vulnerable, it's visible and facing the same. But of course, we also know in all this, we cannot wear a mask against climate change. We cannot have a vaccine against climate change. We can only learn from what is happening in the COVID as human beings and build our own resilience. And I think the High Commissioner said that in his statement of opening, what we need solidarity. This word is really very important to learn from the COVID and fight climate change. And we need responsibility of those who create the climate change to respond by real action to those who are impacted today. So it's issue of responsibility, of urgent response to the humanity in general. If you want to bring back peace and security, if you want to fight COVID and climate change, so you need to enable development and eradicate poverty. That's what we call the Agenda 2030 of the Sustainable Development Goals. And we need to act for the refugee, for the displaced, and leave no one behind. That's why we wanted to have it as a very important point, so we can learn from that one. And we need to act not only like in a development and that's it. I'm talking about the sustainable development. That's respect the human dignity and that's protect the environment. Because we know that the most vulnerable do not depend from the end of the month salaries. They depend from the nature. If the rain come in the right way, they can get agriculture, they can get a pastures, they can get a fish, and they can feed them families. And they can still in the place without moving in order to be a displaced or be a refugee. So they need the human dignity, and that's why we need this development who can respect the peoples and respect the environment. And also we need to learn from the COVID as how we are building the real Green Deal. Because when we say Green Deals, it have to be based in a concrete projects. And in the Sahel, we can say like how it can help the Green Great Wall to be localized, to be for the communities, by the communities, and who can take this project. We need an adaptation method who can help the community to build the resilience and get adapt to the climate effect. And those adaptation methods need to be in a green agriculture, how the family agriculture can be helped. If we are having the extreme weather from the flood as we have that these years, so the most impacted are those who are displaced, who do not have home, who are becoming homeless and again double homelessing. So how that can build them agricultures in order to feed them families. So the Green Deals must be based on this one. And I think also we need to work with all those countries who are the most vulnerable and the countries who have to be the host. And that's come from the second response of the High Commissioner, say that it's a really misunderstanding of the messages. So we need to see how we can use the right messages to build our equity, our justice, and have the response to the COVID and climate in order to live all in the equal way in this one planet we do have. There is no two planets, of course. And finally, we cannot do all that without funding. We know that finance is really very important. And we can learn from the spirit of the COVID on rebuilding the economy, reboosting the economy. We saw overnight how countries come with the billions saying that they wanted to rebuild the economy. So this money needs to go to the most vulnerable, the refugee, the displaced peoples, indigenous communities who have the traditional knowledge, those who hold and who can change need to get access to this direct funding in order to be not only beneficiaries, but to be partners in those projects, fund them for a long term. So we have a lot to learn from COVID, but we need to transform it as an action right now. Thank you so much for this opportunity again. And really, maybe I do not get a chance for talking, but I wanted to say, I would love to have more this kind of discussions, maybe after the COVID, to be physically, to do not leave again no one behind, those who do not have access to electricity or even not to internet, but who are really the front line of all the issues we are talking about it. Thank you.
Thank you, Hindu. Thank you very much. High Commissioner, we have three very passionate, eloquent interventions to react to. I have a feeling you might have a little something to say, especially about the last one, given that you were part of yesterday's ministerial on the Sahel, where the Secretary General made the comment about the breaking point. Thank you for bringing that up, Hindu. But over to you, High Commissioner.
Yeah, I wish we had Hindu yesterday at the ministerial conference on the Sahel. This would have been a more effective intervention than any of us. Anyway, maybe just to tackle that first. Thank you, Hindu. That's important. I just want to say this also for the sake of all the people following us. I believe that going forward in the next 2-3 years, there will be a number of important specific situations that we will have to focus particularly on, and the Central Sahel in particular will be one. There's no doubt. And thank you very much, Hindu, for having made the point that yesterday many delegations at this high-level meeting tried to make, but you did it more eloquently because you speak from direct experience, how interlocked all these causes, drivers of crisis are. Climate, conflict, poverty, and now the pandemic, and how you related it very well to the pandemic. I think we need to really, if there is something that this dialogue should also aim at achieving, is describing better how for refugees in particular, for displaced people, you cannot separate one driver of displacement from the other. You need to really be strategic in addressing all of them. It's very difficult. It's very difficult, and even to conceptualize, but I think you've done it already very well. Good lesson for all. I also want to go back to points that Shadi made and others. I think also Carmen, to a certain extent, the importance of organization. When we say solidarity, working together, it has also a very practical dimension that you need to organize yourself, including refugee communities that organize themselves in order to be more effective in their contribution to society. I say this because clearly many such initiatives have emerged in the past few months in the context of the pandemic, and we have become even more sensitive. I'm speaking of UNHCR now, to the necessity of having a more organized relationship with refugee-led organizations. And I think, Kelly, correct me if I'm wrong, but we're hoping by next year to have a more clear framework within which to work that hopefully will help refugee-led organizations also organize themselves in the right manner. Working in aid, in humanitarian work is complex, is challenging, especially because you need resources, you need to offer certain guarantees to your donors. So I think that sense of organization that came across very clearly in a very practical way, also we will try to work on it institutionally. And finally, two more general points. I think that what came across from this last, especially Shadi, Carmen, the great importance of a crisis like this, offering refugees a sense of dignity, hope, and pride. I think, Shadi, you expressed it much better than I ever could. But it is very, very important because so often in my own interaction with refugees, especially when I used to travel more, I hope I'll be able to travel more again in the future and meet refugee communities, displaced communities. Really, what pains me, of course, is to see the suffering, the physical suffering, the violence, the hunger. But what pains me also is this loss of hope, loss of dignity, and often they go together. So once again, you see the pandemic, for those who really respond in the right way, can also be an opportunity to restore that sense of hope and dignity. And on the other hand, Carmen used such an important expression. She said, I'll quote her in Spanish, cada día tengo una batalla. Every day I have a battle to wage. And the courage that, is the biggest lesson that we learn every day from refugees and that should keep us going. Thank you.
Absolutely. Absolutely. We have lots of questions that I think are being answered also in real time in the Q&A box. Thank you for that. We have an interest by participants in hearing a little bit more from our panelists, their advice in terms of going into the next sessions related to the High Commissioner's Dialogue. The next one is on the 4th of November. And as I mentioned before, it's on protection in pandemics. And I want to we'll go through each of these sessions very quickly, rapid fire, but ask our panelists to give us a bit to reflect on as we prepare for them. And Shadi, if we can come back to you, what does protection mean to you?
Also, it should be a very simple question, but I think answering it would mean many things, could be many things, and too long. But before I start, allow me to stress on the fact that the 21st century, the time we're living, the time we're having the power, the time we are changing, the time we're accountable for, we've been witnessing that the refugees camps have been growing more rapidly than any other time in the history. 1 decade ago, the number of refugees was 40 million. Today, it's 80 million. It's double the number. It's the population of Austria, Switzerland, and Italy together. It's the population of Germany. It's the population. It is important to notice this fact, to acknowledge it, and that shows the importance of speaking about protection. Now, to answer the question directly from one perspective, protection of refugees is the respect of his or her rights as a human, as a refugee, as well as a victim, to be included, as the High Commissioner said it very well, to be included, to be part, and as I like to call it, to belong to this new community I'm in. The color, ethnicity, religion, country of origin should never be a reason or a way or a factor for any sort of discrimination. Now, protection could be, or for me, it's offering a space, safe space of life with dignity, with respect to the human rights, to offer a safe passage for refugees, and of course, creating possibilities for a safe and dignified return for refugees. And consider that the refugee crisis is global as well as the COVID. So it needs a global response. It needs a global solidarity. It needs a global responsibility and share the responsibility. We can't put the responsibility on the others. The others should respond. The others should do. Protection is to feel each of us as individuals, as NGOs, as states, that we are responsible, accountable for this 40 to 80 million number, for the safety and dignity and rights for each one. No one behind, it means really no one less and no one more.
Thanks, Shadi. 1% of the world's population. No, we cannot ignore. Thank you very much for that. Niall, I have the same question for you. What does protection mean to you?
Thank you. Okay, go now. So protection to me means having access to everything a human being is entitled to, dignity, and most importantly, everything life took away from me before I became a refugee. In a temporary setup, it will mean having access to the basic needs for the well-being of a person, such as food, clean water, shelter, healthcare, education, in a decent living environment. But something that is more important is that this should happen when a durable solution is sought, either back home, in the country of asylum, or a third country in the shortest time possible. Thank you.
Thank you, Niall. Appreciate that. So the third session of the dialogue series will be on displaced or stateless in healthcare systems. So I'd like to ask the two doctors if they could tell us what inclusion means to them. Let's start with you, Carmen.
Bueno, perfecto. Acá es muy importante recalcar.
Thank you. I'd like to go back to what I mentioned before. I'm really grateful for the help that I received in order to be able to work as a doctor here in Peru. And I think it's really important to really bolster that kind of help that I received personally, because there are a lot of people in Venezuela, a lot of healthcare professionals, and also lawyers, engineers, teachers, who, unfortunately, because they haven't received that help, because it's incredibly difficult, because it's very expensive, those people are excluded from help, from any kind of aid. And unfortunately, a lawyer ends up being a tradesperson or doing some other kind of job. And there are many doctors who are working in restaurants, for example. They have to do other jobs that have nothing to do with their training. And so I think it's really important to really bolster, to really strengthen that aid that I myself received, so that we're able to continue to help others from Venezuela so that they can continue to positively contribute to society. And I think it's really important to continue to offer aid. So as a doctor, I say this, and other professions who currently can't exercise their profession, they can't give 100% or the best of themselves because they are working in other areas where they're not really specialists, where they're not trained. And so that's why that aid, that support that I received is so important, which is why I have highlighted how difficult it's been, because really it was thanks to that support that I was able to move forward, and I was really able to take advantage of the situation.
Very true. Thank you very much, Dr. Carmen. Dr. Feza, what does inclusion mean to you?
باید از نکات مثبت مفیدی که حالا تو هر جامعه از پناهنده استفاده کنیم.
I think what we are doing, if we should not just expect this help to come from the UNHCR or from an NGO. This help could come from anywhere, and the refugee could help that if the refugee is trying to develop it and realize its abilities, and at the same time help others. If all of us agree that and understand that we should do something, take a step in the right direction to help others.
Thank you. Thank you very much.
متشکر هستم. مرسی.
We lost him. We lost her, actually.
Okay, we have lost Dr. Feza? Yes, I think we may have. We'll hear from her one more time before we close. The fourth session is on what the pandemic teaches us about how we respond to climate action, climate change. And so, Hindu, if we can start with you on what climate action means to you.
Right. So climate action means to me, it's how we can reduce the emission. This is killing all our system. So it means that the responsibility of developed countries to move from all the fossil fuel, all the dirty technology to the clean one. And we do have them, because if we have to invent them, maybe it's take time, but we have them. We have the renewable energy. There are a lot of infrastructure on the renewable building, on efficiency on energy. We have the electric cars, but when we go to the developing countries, people still do not have clean water to drink. And it is the same also for the displaced peoples, for the refugee peoples, still are living in a very precarity. There is no electricity. So climate action means also it's climate justice. How they can give the access to those who are left behind, access to the basic development who is based on a renewable energy simply. How they can get access to the basic education simply, to the basic health simply. How they can be not left behind, but have the living with dignity. And climate action mean also how our world can be developed in a new concept. Economic change. All the economy do not need to be based on a deforestation or in a mining. It have to be based on a equity, justice, and giving access to all peoples in the food. Because we are also seeing how climate change is impacting the food system. I don't know if you saw the last report of the World Food Program on hunger. It's put like my country, Chad, in a most vulnerable, plus 35%. And for us, we know why. Because these years with all the flood around the Sahel, it's impacting the crops. So it will be the food insecurity 100%. In addition with COVID, it will be again 100%. So how it can be responding to the food insecurity and how it can help to build the resilience. We talk about climate adaptation and climate mitigation. So mitigate all the effect of the climate change, reduce the emissions, protect the forest, protect the mountain, the glaciers, and adapt. Build a resilience with a new action that tackling the peoples who are left behind, who are the front line of the climate change, and use the traditional knowledge of indigenous peoples who are the nature-based solution for all of us.
Thank you. Thank you very, very much, Hindu. And Bart, finally to you, what do you think of when we talk about climate action and displacement?
Yeah, all right. Thank you so much for this opportunity again. Yeah, as for me, I think I would need to take the perspective as a refugee youth. For me, climate action refers to roles young refugees take to prevent and respond to climate change. And this include the participation in the cultivation of drought-resistant crops like millet and sorghum, taking part in reforestation efforts, and encouraging the full utilization of solar energy for pumping water, powering houses, and lighting public areas as it's done in Tongogara refugee camp in Zimbabwe. Young people are doing amazing work to respond to climate change, and UNHCR, NGOs, and the broader humanitarian should recognize and reinforce their efforts. And they need also, maybe I could recommend a UNHCR, NGO, and other stakeholders to encourage the community on the good food management practices so that people can use the little food they have wisely, and then to inform the community on time about any foreseen disaster. And there's need also to relocate people from lower lands to upper lands There's need as well to support and teach the community members on how to build stronger shelters. And there's also need to empower refugees with proper knowledge on climate action and encourage refugee participation and strengthen and reinforce refugee youth-led efforts to support and protect their communities in relation to climate action. And another last recommendation that I would give like to UNHCR, NGOs, and other partners, it's to equip refugees, displaced people with entrepreneurship skills, meaning they should provide youth with vocational education so that at least they can start their initiatives or projects, support them with resources such as machinery, equipment, and capital. And the advantage of entrepreneurship is to empower refugees to be self-sustained. And even though they are displaced, but they can earn a living without relying on donor funding. So in conclusion, I can say everything starts with I, then you. Do not say, what did you do? Start first of all, what did I do? And then you can say, what did you do? Thank you so much.
Thank you, Bart. Very well said. So I'm going to start with you because the participants want to know just one thing that you would recommend, that an action that the international community should take to improve the situation of people that are displaced and host communities in relation to the pandemic. And I'll ask each of the panelists before we ask the High Commissioner to wrap us up. Bart, anything that you just mentioned that you want to identify as that one action that we can take?
Yeah, all right. As the action, like in those actions that I've tried to mention, I think I can just take about the entrepreneurship, which will make young people to be self-sustained, which will make young people, even displaced community, to be self-reliant, to be independent. So what I can say, it's for the international organization to support at least a youth, refugee youth, displaced people with vocational education on so that they can start their initiatives, projects, and support them with resources such as a capital, because I know that without resources, there's no any efficient climate action. So we need to support at least with capital, equipment, machinery. And this one, it will also empower refugees to be self-reliant. They will not rely on the funding of donors. They will be self-sustainable. So this is my one action. Thank you so much.
Thank you. Thank you. You got a lot of words into that one action. Very briefly, Hindu, what would be your one action? Very quickly.
Give us space to the decision-making tables and we can change the world.
Fantastic. Dr. Feza, what would be your one action?
در مورد اینکه من به نظرم میشه که اگر
I think if the international community tries to focus on vulnerable countries and countries with less economic prosperity, and invest in the infrastructure of those countries and talk to the host communities and bring forward the people of that countries as well and see what the problems are. Many refugees have had to go to other countries because of security issues and lately because of lack of labor in their own place. If we can work on these two issues and have a clear plan to eradicate the problems, this would really be helpful. And on the other hand, if we can give services, better services in the host communities, as my other friend said here, the refugees are the most vulnerable. They have the lowest level of income, and they have difficulties preparing for the basic needs. This could help them to go up, to lift themselves a bit, and in every aspect, education, health, and where I work. And what we do about this pandemic, this has really led to problems for many families, because those who were hospitalized, we had many people in the hospital, and the income of that family was not enough to cover the costs of the hospitals. If the international community can do more to pay for these costs, I'm not talking only about Iran, I mean everywhere, this could really help, and it could help the host communities as well. It is not just the refugees, because when someone is at the hospital and is hospitalized, when they want to be discharged, someone has to take care of this, the amount of money they have to pay to the hospital. It's either the hospital, it's not fair, I think, even to the hospital to take all the burden. I think more is done. I really liked what the other lady, the physician, said. If we can use all the platforms available in different communities, we can really help grow that community. And I honestly think if we can invest in that, these people would not have to leave their countries. I'm really grateful for what you've done today. I learned a lot, and I'm hoping that I can I can be I can give to the community that has helped me. There are many people here. I've been chosen to be here, and I'll do my best to help the refugee community as much as I can.
Thank you very much, Dr. Feza. We've learned a lot from you, so thank you. Dr. Carmen, very briefly, because we're right at time, one action you would like the international community to take away in terms of the pandemic and displacement? Dr. Carmen?
Sí. Mantener el apoyo.
Yes, to keep the support is key. Support, so we can include or further support both professionals like myself and also those people who are not only medical staff, but everyone, because everyone can give a contribution, a positive contribution. That is why it's so important. Also, with Dr. Husseini, as she said, she is completely right. I completely agree with her. We arrived here as refugees. Without anything, we don't have the necessary resources to be able to pay for all the paperwork we need to go through to have our qualifications recognized in this host country. And that is where you have all the strength to support us and to really help us out, so we can really thrive and contribute in each one of our professions. It has been thanks to you, and like myself, many others had been able to work in the host country, and we had been able to move forward and to help others and to support others thanks to your help. Because if we don't have anything really, if we don't have support like yours, we can't do anything. That is why it is key, the support you have given us as refugees. Thank you very much.
Thank you very much. We appreciate that. Niall, one very brief action.
My recommendation is strengthening communication infrastructure in refugee camp and the neighboring community that will enable continuity of education even in time of pandemics like COVID-19, access to healthcare and protection services. Thank you very much.
Thank you so much. Thanks for the brevity as well. And Shadi, last to you.
Thank you very much. COVID-19 has proved the importance of reliable information and how challenging information during crisis. Refugees live in a crisis in everyday life. My recommendation, which is easy, not political, doesn't need lots of funding, access to simplified basic information. And as Part Helmi said, I'll tell you what I did with a group of local and refugees here in Switzerland. We're starting SELMA, Swiss Association Linking Migrants with Activities, a simplified platform of simplified information, access to information. I think information is really important and essential and could be done quickly, easily. Thank you very much.
Thank you, Shadi. High Commissioner, lots of good ideas here. Some final thoughts before we close?
Yes, thank you, Kelly, and thank you all for very, very inspiring comments. I don't want to repeat what we have already concluded after each round of interventions, because I think already those were precious conclusions that will be useful for the rest of the dialogue, but also for our work in general. Here I have, I'm also taking the cue from your question about looking at the next few sessions, and based on what I heard. To me, perhaps, and building also on last year's forum on the Global Refugee Compact, we need to work more on the notion and on the practice of inclusion. Inclusion is a very complex issue, and you have described it from different perspectives so well, from your experience. And I think that we need to work on it. You see, inclusion is a complex concept. In some countries, it can lead to integration, to refugees permanently living where they are hosted. But in most places, this will not be the case. It is difficult, there's no resources, politically it's impossible, they want to return home most of the time. So, but these conflicts last for so long. What do we do if this waiting period lasts for 10 years, 15 years? We need to work on inclusion during that period. And I think that the pandemic is giving us accelerated lessons on inclusion that we need to really identify, analyze, learn from, pick up the good ones that we can then bring forward in our work on inclusion beyond the pandemic. And if the dialogue can help us through this work, it will be phenomenal. It will be fantastic. I also think that it is important that the dialogue going forward takes other lessons from the response to the pandemic in terms of preparedness, in terms of communication, as some of you said, in terms of utilizing the community, or putting the community, rather, utilizing is not a good word, putting the community in the front. So these are all important, not just for the pandemic. The pandemic will go away, I'm sure about that. Eventually, we will go over the pandemic. We will beat it. There may be others, but we will beat it. But we will be left with the crisis that have no vaccine, as Hindu said, like climate emergency, like, if I may say, poverty, inequality, conflict, and so forth. So let's use this period to really build lessons to respond to crisis and see the interconnection between all of them. Then third, I have 4 points. Third, Niall reminded us, I think, in his previous intervention of a very important element that we should not lose sight of: solutions. When we speak about forced displacement, for most forcibly displaced people, the solution will still be to go back to their homes. And this is what most people want. They want to go back home. Maybe in your cases, it's different, but in most cases, you know it very well, there is no opportunity for integration or resettlement, and sometimes even inclusion, and we heard it very vividly from Carmen and others, is a big challenge. I have seen, Carmen, myself, the doctors and engineers from Venezuela working in the market in Lima and in Quito and in Bogota. I have seen it, and it is very sad and heartbreaking, but that's the reality for most. So what's the solution there? We need to continue to work on solution. This is political work, conflict resolution work, and it is also keep reminding decision makers, politicians, that when they discuss peace, they don't do it very frequently, but sometimes they do. When they discuss about peace, don't forget displacement. We are in a very positive dialogue at the moment. Let me give you a good example with Sudan and South Sudan. two countries, Niall will know this very well, two countries that have been in conflict for decades, but now perhaps they are in a better situation. They're moving towards peace. So we immediately told the leaders there, let's include those displaced in these peace discussions. Let's make sure that when you discuss how peace will be implemented, we make sure that people can return to their homes or there are other solutions for them. This solution theme is beyond the pandemic perhaps, but it is one that we should not forget. And finally, I think really, as we have said many times this afternoon, the importance of this being together in this global emergency that affects all of us. How many times in our lifetimes we will have this incredible situation in which the whole world is equal in front of the pandemic? Of course, this is not entirely true because there are people who will have money to access the vaccine before others, unfortunately. But at the moment, faced with the risk, with this virus that we don't know about, we're all equal. So let's, it's a rare moment in which we're all together. Let's use it to maximum effect. Those of us who believe in solidarity, who believe in working together, have to grab this opportunity. It will not come again soon, even in our lifetimes. Thank you, Kelly.
Thank you very much, High Commissioner. Great way to end. Inspiring panel. Thank you all for your inputs, heartfelt, courageous, brave, and a wonderful start to this High Commissioner's dialogue. A lot of the questions that were not answered will be coming up in subsequent series, so I want to encourage participants to tune in again. Thank you again for joining us. Thanking donors and partners, including the private sector, in terms of the jobs that we've been talking about that are so important during this difficult time, particularly with the pandemic. And a recording of this event is going to be put on the app in the coming days. So if you know of others that wanted to tune in but weren't able to, they'll be able to access it. And remember, this is the first of a series. The next one will be on the 4th of November, same 2-hour slot. And Gillian Triggs, the Assistant High Commissioner for Protection, will be your host at that session. So we look forward to seeing you then. We thank you sincerely for joining us today. Take good care of yourselves and each other. Bye.
Thank you. Thank you, panelists. Fantastic group. Bye-bye.